Republicans in Congress are considering $880 billion worth of federal spending cuts, which Democrats say will impact Medicaid funding. Two Virginia women are calling on congressional leaders to protect the program.
I guess this is my calling in life.
Henrico resident Jeannie Robinson spent her career in social work.
I really love being a social worker. I started out to be an advocate for the children. As this time went on, I ended up being an advocate for abused women and senior citizens.
During COVID, she decided to retire to care for her youngest grandson, who has Down syndrome.
I took a big cut from $40 an hour to $13 to take care of Malcolm. To me, that's worth it for me. It's my family.
During the week, she watches the 7-year-old after school. She gets paid through Medicaid, which he qualifies for because of his disability.
I want to make sure he has a life like everybody else and fairly treated and can progress like everybody else.
Earlier this month, Robinson took her advocacy to Capitol Hill. Congresswoman Jennifer McClellan invited her to attend President Trump's joint address to Congress.
I got to meet people, and also I got to represent and speak up for my grandson and also for people on Medicare and Medicaid.
Robinson worries funding changes could impact her grandson's care.
I know the end results when people don't have those resources.
Another Richmond area advocate is also speaking out against possible cuts to federal health coverage.
I am one of the more than 630,000 Virginians who will be kicked off Medicaid if Republicans in Congress get their way.
Katina Moss joined Democrats on the steps of the Capitol to share her story about Medicaid.
As a Gen Xer with elderly parents, Medicaid supports my family's well-being.
After spending a decade as an educator, Moss was preparing to launch her own business when her mom fell ill.
My mother had a major health event, supposed to be 1 surgery, and it ended up being 3. And she left the hospital in a wheelchair, having to learn at 77 years old how to walk again.
Now, a job helping to run a local florist and gift shop gives her the flexibility she needs to care for her family. It's a familiar role for Moss. As a former youth minister and high school teacher, she's dedicated her life to caring for others.
And I had made very conscious decisions that my skill set was going to be for the purpose of helping youth to develop, knowing that I could have earned more someplace else.
But when money got tight, she had a hard time accepting help.
I had to coach myself on, it's okay that you need public support when your career has supported the public.
Eventually, she signed up for Medicaid through expansion, which allows adults up to a certain income level to qualify for coverage.
I don't plan on, needing Medicaid forever. But while I do need it, it is an absolute relief that I can have it.
As a recipient of Medicaid through Virginia's expansion of the program, Moss is one of the hundreds of thousands of Virginians most at risk for losing coverage.
Virginia is one of 9 states with automatic trigger language that says if the federal government goes back on its promise and reduces funding for Medicaid expansion even by 1%, then the entire program ends and everyone in the expansion population loses our health care.
Both Moss and Robinson say they will continue to advocate against Medicaid cuts as Congress considers future federal funding bills.
So until I close my eyes, I'm going to be an advocate for whoever needs it.
Adrienne Horma-Gibbon, VPM News. Thank you for watching. Make sure to subscribe to the VPM YouTube channel, hit the bell for notifications, and visit vpm.org for more in-depth coverage.